Without further delay, it's my pleasure to introduce our next speaker. This is Dr. Alison Phinney. Dr. Phinney is a professor in the UBC School of Nursing. Her research takes a very broad view of health to identify the capabilities of older adults to successfully cope with functional consequences of aging and disease. And I know a lot of her work focuses in on individuals with cognitive impairment, which is why it's such a clear implication in terms of our talks today, or our topics for today. So the title of her presentation is The Role of Activity in Supporting Social Citizenship in Dementia. Please welcome Dr. Phinney.
Thank you very much. Let's see. There we go. This is a picture of me from a very long time ago when I first entered into the world of healthcare as a nurse. And I had the opportunity to care for people with dementia in hospital. But I was a real newbie, and I focused a great deal on what people had lost. I thought a lot about what I could do for people who couldn't do any longer for themselves. But with a little bit more experience under my belt, I started to wonder something about what it was like to live with dementia, and figuring out that if I was a nurse, couldn't I do a better job if I understood something better about what that person was going through? So I had the opportunity to go back to school, and that was the question that really stuck with me. But it was 20 years ago, and when I said I wanted to interview people living with dementia, I was told, well, that's impossible. I was told we could watch, we could observe, we could talk to family caregivers, but people couldn't tell me anything directly themselves because they wouldn't be considered to be reliable witnesses to their own experience. But I was stubborn, and I'm glad I persevered because I did find ways through my research now over the last 20 years to use qualitative methods in a way that allows me to connect with people with dementia through basically, as the cute little drawing, through a lot of walking and talking. So really informal conversations, hanging out at home with people, with their families, observing, yes, having conversations, asking questions, and listening carefully to the answers. Taking photographs, sometimes video, and sometimes sitting down and watching that together with people afterwards and talking about what's going on in those images. So really, it's been a case of being creative and open to new ideas about how to conduct research with people, not on them. And it has certainly been humbling to listen with people who, with great patience and good humor, have helped me to understand a little bit, maybe, about what it might be like to feel slow, to feel lost, or maybe uncertain. Through all this time, I've also heard a great deal about what has brought meaning into people's lives and how everyday activities are hugely important in this. And really, it's this question of activity that has been a real hook for me. So I think we so often think about dementia in terms of disability. And through my work, what I'm trying to do is really turn that on its ear and instead be asking questions about ability, about capacity, and the importance of doing things that are meaningful. Like this man here, this is a still from a video. He needed to clear the brush behind his house and was showing the research assistant how he did that. Activity is really important. So, what have we learned through all of that? What kinds of activities, beyond brush clearing, really matter? So what I'll share next are really just kind of a broad overview of what we've learned from a number of different studies. And the first thing is, physical activity is really important to people. They value being active. People want to stay sort of moving for as long as possible, doing activities that they enjoy. Walking is a really huge part of that. It makes total sense to me that walking has become such an important really focus of the activity with Paul's Club that we heard about earlier. But people also swim, they garden. A lot of outdoor activities have really mattered, but also dancing, exercise classes. We've also heard a lot about creative activity. Now, this was never anything that we set out to ask about explicitly. We never thought of looking at creativity in the arts. But when we went back and looked at all the people that we'd interviewed over the years, a full third of those participants in this very kind of descriptive exploratory research had spontaneously talked about the importance of creative expression. Sometimes it was something that they'd done all of their lives, but for others it was a new activity. And this includes things like music, painting and drawing, craft work, photography. Art and imagination, we have learned, plays a really important part in people's lives. And finally, doing things with others has been a consistent theme in our research. So really being engaged, not just in the home with family and immediate friends, but being engaged in the broader community through social and recreational groups, that is an enormously positive experience. So I just want to remind you, none of this research is something where we've kind of designed a program or an intervention and then tried to see its effect. This has really been descriptive research where we've asked people, what are you doing that's important to you? And it turns out that what people are doing are activities that we know from other research have really important benefit for health and well-being in general, for all of us, right? So people are choosing very well. But beyond these objective health benefits, what are people getting out of it? So we've tried to understand really why does it matter? And one thing is that through these activities, people have a stronger sense of autonomy, of independence, of agency, of having power and control in their lives. Especially around physical activity, for example, people who will say, my brain's not so good, but my body still works. I still am here and I can do these things. Perhaps I should have put this first, because ultimately I believe maybe this is the most important thing. As researchers, we tend to poo-poo things that are merely fun. I don't know about you, but I want to have fun as I get older. And if I get dementia, I want to enjoy my life. And that's what we've heard a lot about why these activities are important. As this one gentleman said when he was talking about music and singing, he said, I can express joy and happiness. It is one of the most wonderful things. But through activity, people also feel a strong sense of connection and belonging. As one person said in talking about a group that he was a part of, he said, you feel like you're wanted. So, if I were to sum all of this up, what would I be suggesting? Get your body moving and outdoors if at all possible. Find ways to express your imagination, whatever works for you, and hang out with other people. And I added this piece. Even if you, like me, you're an introvert, hang out with other people. It is hugely beneficial. It's all well and good. And I realize when I've just spoken, I've spoken to all of you as individuals. And we can see how, as individuals, we can take some of that up. They're good ideas for all of us. But it can be hard to do all of these things. And we're arguing with the work that we're doing that it shouldn't be up to only individuals and their families to figure it out for themselves. So really the question that we're asking now with our research is, how is it that we can organize our communities in such a way that there's opportunities like this available to everyone? So this is really linking so beautifully with what Maria talked about earlier in terms of dementia-friendly communities. This is really where our research is going next. And this is where this idea of social citizenship fits in. So activity is not just about good care. Activity is an expression of social citizenship, which we define in this way: that someone with dementia is entitled to experience freedom from discrimination, and I might include stigma as a part of that, and to have opportunities to grow and to participate in life to the fullest extent possible. That's the outcome that we're interested in exploring. So we have a new project. We have literally just begun with a small amount of seed money from the University of British Columbia to create connections with people in the University of Washington. So we've very cleverly called this Citizenship Across Borders. And what we're interested in doing is looking at this question of meaningful activity in support of social citizenship for people with dementia. And it's really about building connections with researchers and community partners in Vancouver and Seattle to learn from each other about how we can do this well. Okay. So I just wanted to, how am I doing for time, Phil? 5? Okay, I think that's good. What I wanted to leave you with, as you know, this is a beginning study. We don't have findings yet. But what we have done, we were just visited Seattle just recently and came away hugely inspired, recognizing that we have here in the Lower Mainland in British Columbia some really exciting examples of community innovation to support social citizenship through activity. We heard one example this morning, Paul's Club. I don't need to tell you anything more about it. Nita already did a fantastic job. But this is an example of the kind of thing that we're thinking about. And it was really my work with Paul's Club that made me think about this, the importance of looking at what are we already doing in our communities that is supporting people with dementia and supporting well. So Paul's Club is an example here in Vancouver. Another project is called Raising the Curtain. Now, has anyone heard of this? It's on the Sunshine Coast. So the Imagination Network, and I can give people websites later, but it's a collaboration between artists, healthcare professionals, and care staff, and researchers, and people with dementia who are together, who are turning a nursing home in Seychelles into a kind of a creative art space and inviting the public in to share in the work that's being generated there. The Frye Museu in Seattle is a private museum that offers a whole suite of programs through their creative aging program, and that's offering a range of arts-based activities that are all focused on engaging people with dementia and their families, sometimes in the gallery space itself, other times at home, and it's really for people with a range of interests at different stages of the disease trajectory, and people who might be interested in looking at art and discussing it, or people who might be interested in creating it. But through this private museum, in collaboration with the university, they're offering these programs and starting to look at some of the impact that is having. The Gathering Place is an activity and discussion group for people with early-stage dementia. It's offered through a senior center in one of the neighborhoods in Seattle. And as you can see, I just took a screenshot from their homepage. They offer, again, a whole series of programs. They call them memory loss programs. And it's just covering a whole range of interests and abilities. So everyone could find something there. They have a weekly song circle. They do zoo walks. They have a kind of a theater group for people who are into acting. I have an Alzheimer's cafe. They have a book discussion group, yoga classes, all kinds of things that happen in community. Garden discovery walks. There was just a webinar a couple days ago, right, Lynn? Offered, and because through Seattle, through the Washington State area, there are a whole slew of walking programs, different kinds of walking programs for people with dementia. And they did a webinar that explained to individuals and other groups who might want to do something like that, with all kinds of really great advice. So if anyone's interested, I can get you the link so you can watch that talk. It was really valuable. But here's one example, garden discovery walks. So on a weekly, actually it's not on a weekly basis, it's on a monthly basis, a group of people with dementia come together and explore a garden somewhere in the Seattle area. What's really quite exciting is Momentia, again in Seattle, as a network. So it's an informal network, and the goal of this is to connect different grassroots community programs around the region. So I think we've got a sense that there's a lot of smaller things happening, just as there are here, but I think on a smaller scale, but we see lots of potential. But that question around scaling up, how do you connect this together? So there is this informal network in Seattle, and what's important here is that it is led by and for people with dementia. This is a really vibrant and visible group. They have these fantastic tie-dye, real West Coast vibe T-shirts, and they're very much focused on reducing stigma. It's about getting people involved and creating community. And some of the ways they do that are quite simple. So they make T-shirts, and they create an online calendar. You can't see the details here because it's too blown up, but you can click and you can see these are all the activities that are happening in Seattle. Seattle's the same size as Vancouver. It's about 700,000 people. These are all the community activities for people with dementia that are offered there. I believe that we can do that here as well. And that's what we're hoping to do, is learn from them. And they're going to learn something from us about how to do research to show the impact of this. And I think... So I guess just in conclusion, if I'm good for a couple more minutes, I guess where we're ending up with this is just some appreciation of the extent of community innovation, about creating opportunities for meaningful activity in dementia. So as I said, these grassroots efforts that are really popping up because there are people that see a need and they want to do something. And with our current research, what we're really trying to do is figuring out how to connect and grow these, and to do these with full participation. These words are from Mary Grace Becker, who coordinates Dementia from her position at the University of Washington Brain and Memory Wellness Center, which she said, this is really all about stepping back so people with dementia can come forward with bold ideas. So that's really the vision for where we're going next with this research. And I believe that's it. Thank you.